and 60,000 people in our state are affected by this shutdown. That's why Trump and the Republicans must come to the table to protect the health insurance, the health protections for everyone. That's a huge question. The Commonwealth of Massachusetts could lose over $2 billion in Medicaid funding annually, with Massachusetts hospitals losing $424 billion each year, easing the burden for multi-millionaires on their tax breaks, but erasing 19,000 healthcare jobs here in the Commonwealth. After ripping healthcare away from hundreds of thousands of Massachusetts residents, MAGA Republicans are now willing to dramatically raise health insurance costs for even more families. If the premium tax credits from the American Rescue Plan expire at the end of this year, 337,000 Massachusetts residents will see health insurance costs spike. In the process, our residents collectively will lose $425 million in tax credits each year for their health insurance, averaging over $1,300 for each enrollee in the state of Massachusetts. Some could see their premium surge by $1,000 a month, leaving them an annual premium of more than $25,000 a year for their health insurance. That is unacceptable. The price of groceries is up. The price of electricity is up. And now Trump and MAGA Republicans want to jack up the cost of your health insurance, forcing families from Boston to the Berkshires to make difficult choices to make ends meet. Right now, thanks to the tax credits being on the books, a couple in their 30s earning $50,000 in Suffolk County with 2 children could pay just $4 a month for their health insurance premiums. But soon, if Trump and MAGA Republicans decide to let these credits expire, this couple will receive a notice in the mail that they will have to pay $176 a month, a 4,000% increase, costing thousands of dollars per year, where all it was $4 a month. A 62-year-old couple living in Watertown who earns $86,000 a year could pay $1,700 more every month for their health insurance. A 58-year-old living in the Berkshires making $32,000 a year could see their premiums increase by 170%. Republicans are making a Jenga tower out of our healthcare system. They remove one block after another block, and all of it is in danger of collapsing. Access to Medicaid, and then another block, access to insurance tax credits. They've already put us in a healthcare crisis in our country. But they don't stop there. Republicans have cut or frozen over $1.3 billion in grants to Massachusetts from the National Institutes of Health for life-saving medical research and clinical trials. They're gutting our public health workforce by revoking temporary protected status for Haitians and Venezuelans and directing ICE to terrorize lawful immigrants who are disproportionately healthcare and human service workers here in Massachusetts. We know that these cuts will have even worse impacts on Black and brown communities. Right now, 60% of Black children rely on Medicaid. Let me say that again. In our country, 60% of Black children rely on Medicaid for their health care coverage. If these cuts go through, millions could lose access to checkups, asthma treatments, and mental health care that keep families healthy and children in school. It would leave parents with impossible choices between medicine and meals. Restrictions on Medicaid don't just trim budgets, they cut into families' lives. With each Jenga block Republicans remove from the tower, American healthcare becomes more and more unstable. And we know how Jenga ends. The tower collapses. That's what we're talking about. We're talking about a domino effect as each block is taken out, as Medicaid is reduced, as the Affordable Care subsidies are reduced. It ultimately results in emergency rooms being flooded, in hospitals having to raise rates, in services being cut, in families getting sicker without access to the care they need. That is what we're talking about right now. Democrats are not going to allow our healthcare system to collapse. While Republicans put a premium on kicking Americans off of their healthcare, Democrats are fighting to keep premiums affordable for all Americans. Republicans call it a government shutdown because they don't want to admit what they and Trump's allies are actually doing. A health care shutdown is going on in our country right now. The Republicans are shutting down our government over health care. They want to cut Medicaid, the Affordable Care Act, NIH, veterans' health benefits, and Democrats are saying no. We're going to fight. We're going to fight for the health care of every family in our country. Speaker Johnson has put Republicans in a political witness protection program. They're going home for 4 weeks. It's impossible to negotiate with someone who isn't even in the city. It's a political witness protection program for the Republicans. We're saying to the Republicans, come to Washington, sit down, let's negotiate over the health care of every American, but they are refusing to do that. And to my Republicans, who I serve with in the Senate, it's not the fear of God that's going to move you. It's going to be the fear of voters, because you're turning Main Street into Pain Street across our country. The health care that you're going to be denying to those who need health care the most in our society. That is what is happening. So they're hiding right now, but they're not going to be able to hide forever, because these are unjustifiable health cuts. They're running from their jobs because they know they haven't done their job. The American people cannot afford for the Trump administration and MAGA Republicans in Congress to continue to hold our federal government hostage. Funding for women, infants, and children nutrition programs, known as WIC, runs out later this month. That's 125,000 people in Massachusetts dependent upon women, infant, and children. It supports nearly half of all infants in our state who would lose support for vital nutrition care during pregnancy and early childhood. At the end of October, funding will also run dry for the 11,000 children in Massachusetts who attend preschool, thanks to Head Start, and for the 1 in 4 Massachusetts households that use SNAP to put food on the table. 50% of all children in the United States will be on SNAP at some point in their lives, and they are seeking to decimate that program. That's healthcare for kids who need it. Republicans are putting Massachusetts children and families in jeopardy with this shutdown. While families are gathering around the kitchen table, figuring out how they will make ends meet, Donald Trump is refusing to come to the negotiating table. If Republicans do not reverse their health care cuts, some rural hospitals are going to close their labor and delivery units, forcing someone in labor to travel twice as far to deliver. Families will lose coverage and postpone visits to the doctor, risking their health problems becoming more severe. Hospitals and community health centers will be overcrowded, forcing patients to wait longer for care. The urban hospitals, the urban community health centers, they're going to get flooded by all of the additional patients, which will be looking for the care which their families need, right here in Upham's Corner at Boston Municipal Health of the century. All around our region, we're going to see this flood of patients. People fighting cancer or addiction will lose their care or have to pay dramatically more for that care. Research funding going to find the cure for cancer or Alzheimer's will go away. They are slashing research for Alzheimer's, for cancer, for diabetes, for all of the diseases which run through the genetic code of every single person. And they are stopping the research on finding the cure for those diseases. And the Democrats are saying, you cannot shut down the government because you don't want to fund those programs to provide for every single family in our country. People are going to get sick while the rich get richer because of Donald Trump and Republicans' healthcare cuts. The great Massachusetts sage of Concord, Ralph Waldo Emerson, once said that health is the first wealth. If health is the first wealth, Trump and Republicans want to make sure American families go broke. And they want to take that money in order to give it to the wealthiest people in our society. So the Republicans just robbed the American people of their health care coverage, and now they're expecting the Democrats to drive the getaway car. We're not going to drive the getaway car with the funding for the health care of every family in our nation. We're going to stand and we're going to fight. And if they want a health care shutdown, showdown, we're ready to have it. Because what we're talking about are families all across our nation who need that care. And what are Democrats fighting for? To put health before wealth, to preserve access to health care, to prevent health insurance costs from increasing by potentially thousands of dollars each and every month, and to protect the health and well-being of American families. The people of Massachusetts have my word. I am going to keep fighting every single day as the lead Democrat on the health subcommittee in the United States Senate. This is bringing out the Malden in me every single day. I am going to fight for the health care for every single person that needs it and deserves it. There's just simply too much at stake. So now let me turn and introduce to you Audrey Morse Gastire, Executive Director of the Massachusetts Health. Welcome.
Good afternoon, and thank you so much to Senator Markey for bringing us together today and for your fight in DC, having the back of the Massachusetts healthcare system and folks all across the United States with respect to their healthcare access and their financial security. I also want to thank Upham's Corner for hosting us here today. This health center is one of the Health Connector's stellar navigator organizations, providing enrollment and renewal support to the hundreds of thousands of people that we serve here in this community and across the Commonwealth. I'm thankful for the work that they do every day to help people get covered and stay covered, now more than ever. Open enrollment begins on November 1st. That's just a few short weeks away. What does that mean? That means that starting this weekend and over the next several weeks, we will begin the process of determining our members' eligibility for their 2026 health coverage and their subsidies. In the next week or so, hundreds of thousands of people across this state will start to receive details about their status. And in many cases, they will see significant health insurance premium spikes due to the slated expiration of enhanced premium tax credits, slated to end at the end of this calendar year. These tax credits make health insurance more affordable for more than 330,000 residents here across the Commonwealth of Massachusetts. These people, who are our family members, our friends, our neighbors, are going to see premium increases that may make their health coverage unaffordable if those tax credits are not extended by Congress. The average loss in tax credits per person will be more than $1,300 per year, with some people seeing increases of $10,000 per year in some cases. For example, a self-employed couple right here in Dorchester, earning a little bit over $87,000 a year, currently pays about $508 a month for their Connector Care plan. Next year, if the tax credits aren't extended, they would pay over $1,500 for the same plan without any help, tripling their monthly premium. Losing the enhanced premium tax credits would create an estimated annual loss of about $425 million in help paying for health insurance coverage here in Massachusetts for our residents. That loss of financial support will lead to thousands of Massachusetts residents making difficult decisions about their family's finances, and many will make the decision to drop coverage. Quite simply, at a time when it seems like everything from groceries to electricity to transportation and childcare is getting more expensive, not extending these tax credits adds one more increasing payment that could be avoided by continuing to provide this help to the people who depend on it. Nationally, more than 24 million people across the country have coverage thanks to the Affordable Care Act, and it is estimated that more than 4 million of them will drop coverage if these enhanced premium tax credits are not extended. These harms, these material harms we are staring down the barrel of, come on top of other immense setbacks in our healthcare system as a result of the so-called One Big Beautiful Bill Act passed this summer. As a result of that bill, we are no longer able to offer any subsidy at all to 37,000 people in our Connector Care program here in Massachusetts. This population is comprised of legal immigrants, that's legal with an L, legal immigrants who are under the poverty level in what is known as the 5-year bar, waiting for their eligibility for Medicaid. The Commonwealth, through the Health Connector, had been able to offer these people who are, again, earning under the poverty level, earning under $15,000 a year, health insurance with no premium to date. Instead, starting in 2026, this January, these members will no longer be eligible for help paying for their health insurance, making coverage unaffordable for these people. Many will become eligible for Mass Health Limited or Health Safety Net coverage, providing services through community health centers just like this one, but it will not provide the depth of care and coverage that a Health Connector plan provides. Health insurance at its core is about security, stability, and getting and staying healthy. The loss of subsidy eligibility for tens of thousands of legal immigrants here in the Commonwealth and this looming uncertainty about the potential loss of enhanced premium tax credits for hundreds of thousands of people across Massachusetts undercut those benefits and so much of what we've held dear here in Massachusetts in our healthcare system for decades. And Massachusetts families who only want the right to be healthy and to protect their families, and they deserve a system that they can count on. Thank you again to Senator Markey for his commitment to delivering affordable coverage to everyone and for shining a bright light today and on all the recent weeks and months and going forward on the need to extend these enhanced premium tax credits and support people here in Massachusetts and across the country at this pivotal time for the future of healthcare access for Americans.
Thank you, Audrey, so much. And we are we're in a healthcare crisis right now, and we're going to hear from the executive officer of Upham's Community Care, Jay Trevetti. Thank you.
Thank you, Audrey, for your leadership and partnership, and thank you, Senator, for being here today with your unwavering commitment to ensuring healthcare access for every person in Massachusetts. It's truly an honor to welcome you both to Upham's Community Care, a place that has been a part of this neighborhood, built by the community and for the community for over 50 years. Upham's is more than a health center. We're a network of care. We provide primary care, WIC, behavioral health, pharmacy services, home health care, and a program of all-inclusive care for the elderly known as PACE. Together, these programs form a safety net that allows people not just to get care, but to live healthy and dignified lives right here in their community. But like many community health centers and PACE organizations and home care organizations across the state, we're facing real challenges. Across Massachusetts, 870,000 individuals receive care from a community health center like ours. Nationally, that number rises to 34 million. These centers save the healthcare system billions of dollars each year. Billions of dollars each year by keeping people out of emergency rooms, out of hospitals, and providing the right care at the right place, at the right time, in the right language, in the right community. Yet, despite the proven value The federal Section 330 grant, which is the cornerstone of community health center funding, has not kept up with the rising costs the senator was just speaking about. That underfunding leaves health centers across the country with a $5 billion annual shortfall in uncompensated care. Nearly half of all health centers that operate right now operate with less than 90-day cash on hand margin. We're also facing real threats to the 340B drug pricing program. This program helps us provide affordable medications to patients and supports programs that for-profit models won't sustain. When pharmaceutical companies restrict and undermine 340B, it doesn't hurt the institution, it hurts the patient. It means fewer resources for prescriptions, care coordination, and community programs. Here at Upham's, we've seen an impact on all of those programs firsthand. Our community pharmacy was established about a year ago when national chains continue to close in our neighborhood, creating pharmacy deserts because their profit margins became too small to justify staying. We opened our doors because access to medication is not optional. The same is true for our home health care program, which began decades ago when other agencies would not come into our community. We did because we believe everyone deserves care at home where they are comfortable and supported. That commitment to go where others won't is part of Upham's DNA. And then there's the PACE program, which is entering its 30th year of caring for frail older adults, helping them live independently, safely, and with dignity at home, in the community. Upham's PACE maintains a 97% patient satisfaction rate, and yet across the state, 7 of the 8 PACE organizations operated at a loss last year. Federal Medicaid cuts projected for 25 and 26 could put even more strain on that model of care. We need to protect and strengthen these programs, not just for Upham's, but for thousands of other organizations of community health centers and PACE programs that depend on them. Our people depend on it. That means renewing and increasing Section 330 funding to provide stability for community health centers, protecting the Medicaid and Medicare funding programs for PACE and home health, and preserving the 340B program, which allows us to stretch every federal dollar further and to serve those who need it most. Senator Markey, your voice and your leadership has always reflected those values. And as a Medford boy, Malden and I get along just fine. This healthcare is not about politics, it's about the people. On behalf of our board, staff, and the thousands of patients we serve, and the families we serve, I want to thank you for standing with our community health centers, PACE programs, and home health, and people of Dorchester. Together we can ensure that healthcare from our clinic to pharmacy will continue and remain local and equitable. With that, thank you.
Thank you. Jay is right here delivering the care at Upham's Community Care. That's what they do all day long. What Audrey does in running the Massachusetts Health Connector, what Audrey does is connect people who need healthcare to the places that can then help you with those healthcare things that they need to have treatment for, are taken care of. What the Trump administration is disconnecting patients' access to the care which they need, not connecting them as the Mass Health Connector does every single day. And we have with us now the chairman of the board here, but also a patient, and that's Margaret Leahy-Worth. And I'd love it, Margaret, if you can come up and just tell this story from the perspective.
As many of you know who know me, know that I absolutely hate to stand here and talk to people. But there's a number of things that you've already covered. One of the things that I didn't hear covered is something that alarms me greatly. I work with children. Vaccines will no longer be available that are paid for by the government, and they're expensive. And we also have some people in Washington telling us that we don't really need vaccines anymore. I mean, When I grew up as a child, we had polio. We don't have polio anymore. I'm finding it hard to believe there's not a cause-effect relationship there. Many of our patients are poor. I would say most of our patients are covered by Medicaid. And I'm one of those patients, and I shudder to think what will happen to my premiums going forward. I'm not young. Yes, I said it. But I at least have a voice. I'm a big mouth, actually. And I have a voice that can speak for myself and go looking for what I need. Many of our patients are from other countries who don't have that same ability, and that, to me, is criminal. Another thing I don't think we've really thought about is when patients come to our doors, if they don't have insurance, we don't turn them away. We still see them. We may not get reimbursed, which might mean we're looking at a severe deficit because we're not getting the funding we need. So keep up the good work, Senator Markey, because somebody needs to do it and it's not getting done right now.
Thank you so much. Margaret's the youngest person in the room. It's not your age, it's the age of your ideas, and she's the youngest person here because she brings the wisdom of the ages. You know, we pretty much got rid of polio, measles, all of these other diseases that used to afflict our society. And the commitment that the Trump administration has is to make America sick again.
Yeah.
To just give people a sense that they don't have to get vaccinated, that their kids don't have to get vaccinated. That we'll see, once again, a repetition of the same healthcare lessons of the past. And that's why we put Medicaid and Medicare and the Affordable Care Act and Social Security and vaccines and NIH funding all in the books. Trump said yesterday that if he gets a chance, he's just going to cut Democratic programs. And he's right. The Republicans voted against Social Security when it was on the floor. They voted against Medicare. They voted against Medicaid. They voted against the Affordable Care Act. They voted against all these programs in the first place. They harbor an ancient animosity towards the programs which have transformed the lives of ordinary families in terms of their access to health care. We've extended life expectancy by 30 years in just the last 100 years of our life by giving ordinary families access to the health care that the rich had always had access to. So that's what we're really fighting over. We're fighting over ensuring all those protections stay in place and get expanded, but not slashed the way they are. So I'm just so glad to answer any questions that any of you may have.
What's your response to those who want for you to reopen the government and then start negotiations?
The Republicans can reopen the government with one vote. Solve the healthcare crisis and put the federal workers back on. It can only take one vote. We can do it on Tuesday morning, as soon as we come back to Washington. So it's a very simple solution. What the Republicans want to do is not resolve the healthcare crisis, and for us to trust them that they'll solve it in the future at some point that we may never reach. So what the Democrats are saying, no, reopen the government and solve the healthcare crisis. One vote, let's do it on Tuesday, and the workers can be back on the job and people can get the healthcare which they need. That is what we should be doing. Otherwise, what the Republicans have been doing is they've been promising to negotiate, but then they cut the programs that had been agreed to. They slashed the PBS budget to zero after they had agreed to fund it, after it had been passed on a bipartisan basis. They're doing the same thing with program after program. So we can't trust them. There's an old saying when it applies to Republicans: we'll double cross that bridge when we get to it.
Yep.
That's what they want us to do. Trust them in the future. No, come to the negotiating table. Come back from wherever you are around the country. Sit down at the table, solve this healthcare crisis, put it on the president's desk, and bring home from home, all the federal workers and put them back on the job, all at the same time. Let's get it done, let's get it done. Any other questions that anyone might have about anything? Are you with the press?
I'm on the board.
Okay, no, so what, we can talk after, so just the press here.
Okay.